The coverage gap impacts working class people. And so often the incorrect narrative is those lazy people, why should we pay for their insurance anyway? The reality is, in our great state, this slide represents the top 10 jobs in our great state. And for this example, we're going to say that you are a single head of household with 2 children. If you are working in food prep, you got a problem. If you're working in retail sales, you have a problem. If you are a laborer, you have a problem. In customer service, if you're a customer service rep, and that problem is you can't meet your own basic needs, which means that you are more than likely uninsured. Many jobs, unfortunately, do not offer insurance to everyone. And so there's not universal coverage. And the only position on this chart that pays a self-sufficient wage, and I was not paid by Cone Health to put in front of you, is a registered nurse. When you are in a home trying to raise 2 children and you are not making $25 an hour, and if you work in one of the top 10 jobs that is not a nurse, you have a financial challenge. And so a couple of things that I would love for us to think about. I would love for us to think about creating a new narrative as we talk about expansion. We must be ambassadors for expansion. And very specifically, that new narrative needs to take into account recovery from COVID-19, but it also must tell the story that expansion is good.
So let's talk about how much all those things cost. She has no insurance. So the consult is $300. Her x-rays, the type that I need that would be useful, are going to run her about $500 between the x-rays themselves and the reading from the radiologist, another physician. The physical therapy is going to be at least $1,500 because she has to have an initial consult and then she has to have 4 to 6 weeks of treatment, like I indicated. If things don't go well, she's going to need an MRI. $1,800 is a very conservative estimate for a lumbar MRI, paying cash. She needs an epidural injection, maybe. That's going to be at least $300. And as I mentioned, those medications, so we would use like a neuropathic agent, a nerve pain medication, pregabalin, maybe a muscle relaxer, and the NSAIDs. That's going to total about $160, and that's only for 1 month, for 4 weeks. Now, here's the crux of the matter. So if you look at the next line, opioid medication, a price for hydrocodone for 30 days, taken 3 times a day, that's $30. Next slide, please. So this is what she gets. It's not the standard of care. We're not treating these people appropriately because she can't afford it. So she shelled out the $300 for a consult because she's missing work and she can't have that. She comes in, all these things are discussed, and we discuss all the medication. Well, the things that she really needs cost $160, but she already spent $300 for a consult, and she can't afford to miss any more work. So, she gets an opioid because it's cheaper. It's $30 a month versus $160 a month. And this is really the issue that we're dealing with. We're in the middle of an opioid crisis, and people can't afford to have access to the care that they actually need that would make a difference. The opioids are cheap, but we've made everything else expensive. And I mean, some of these things, they are expensive. They cost money to provide quality care, but if you don't have insurance, you can't afford it. And this lady can't miss any more work. Next slide, please.
I'm also a proud veteran, 22 years United States Army, but what about North Carolina being a powerhouse military state? And these folks that are actively retiring right here in our state, going to work for some of these jobs and doing these types of jobs. unless they have an injury from the military, they got no health care. These are people that have served our country that are coming home to communities that have no opportunity for health care. Even the VA, like I said, they can go to the VA, but they have to have been injured on the military and carry that with them. So how do you justify that to the people that have served this country to come home and fight for health care? It's just ridiculous in my eyes.
It would be so much better if they were on a benefit, Medicaid, that they would know that I can go to the doctor if I need to go to the doctor. I can get this taken care of. I don't have to wait until it is a full-blown infection and we're going, holy gracious, what is that? And rural America needs this. We need to close the gap. We need it. It's a win, 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 win. It's a win for the patients. It's a win for healthcare organizations and healthcare individuals working in rural America and in North Carolina. It is also a win, most of all, for the community, because we know if you're not having to spend all this money on just trying to not be sick or treat a sickness, then that money will be regenerated in the community. And it's a good thing. It's a win for the state of North Carolina.